Good morning, ladies and gentlemen, my esteemed colleagues. Allow me to introduce myself. My name is Dr. Bond Suriya. I'm the hair transplant instructor for farm, and I do the hair transplant for several clinics. There are several popular clinics in Thailand. You can name it. Actually, I'm the one who do the hair transplant from harvesting and transplanting myself most of the time. And currently, it's amazingly that many clients ask for what we call long hair transplant nowadays. For my practice, I no longer do the short hair transplant anymore because of the popularity of this long hair techniques. So I would like to share with you on this one. Okay. It's transformative innovation. The long hair techniques, this approach is not only redefine how we perform the hair transplant, but also help the patient to address their problem immediately. You know, they get immediately confidence. They get to the social visibility is good and making the increasingly relevant in our field. It's more like advanced technique, so I just try to introduce this technique to you guys then. Okay. So the agenda is include first a quick review of the traditional hair transplant techniques, and the second is an in-depth exploration of the long hair techniques. Third is current trends and its growing popularities. Fourth is case study demonstrating the real-world application on these techniques. And the fifth one is the future direction and concluding insights on this technique. By the end, you will appreciate the practical benefit and revolution potential of these techniques in the modern hair transplant. But before we can appreciate that, let's go to the background of the hair transplant technique first. Okay. It's just a briefly history. Actually, we start to do the hair transplants from what we have record is 1950s by Dr. Norman Orendrich. He performed the first hair transplantation for the male pattern baldness. But what he do is actually he harvests really what we call a plug of hair. Then one harvesting graft is contain about almost 20 follicles. Just imagine that 20 follicles in one plug. What gonna do to the cosmetic look of the patient? Of course, building such a big hole on the scalp. So back then they described as a door effect or the checkers table effects on the back of the patient. So, but it's a good start then because he at least know that the hair on the back of our head and on the sides it actually resists on balding. So we use those hair to transplant back then. He used for I think 4mm punch techniques and transplant grafts containing 20 to 30 hairs in there. You have to know that basic is actually if you look at our hair, it's contain the average of 2 follicles per graft. Most of the time we get 2 and 3. Sometimes we get only 1 if they have the effect from the DHT already, it's start thinning and stuff. So think about 20 to 30 hair is a quite large one. So that's the last size and left what we call the big scar in the patients. Then in 1990s, so they emerged with FUT techniques. So in the FUT techniques, they find out they can harvest. Actually, they use the stripe cut to the back of the head. Okay. Actually, I let you see in the other side. So on the big scar over there, they have the FUT techniques. So they just harvest things like that. And then they use microscopically a camera or microscopic to look at the graph, and they cut into like 1, 2, 3 grafts per follicle units. So it start to define follicle units back then. So now if we harvest it, we get 1 graft follicle unit, 2 graft follicle units, I mean 2 hair follicle units, and 3 hair follicle units basically. But actually this type of method is called gold standard techniques back then because you actually give the patient the natural look in the hairline. However, with the strip and scar, with the linear scar like that, some people feel unacceptable. Then it's become the FUE procedures. So they replace that scar into they divide the area of harvest into the larger area. They use small punch of the hole. Sometimes they use I use 0.9 millimeter on diameters, but back then they used like 1 or 1.2 millimeter punch in diameter to punch. The results just like in the pictures. You see a bunch of hole in there. However, these two techniques still require patient to shape their head, especially on the donor area. It's like a blind procedures. Just look at the scar over there. You can't tell what it's going to look like in the future if the hair grow. You just think that okay, if we divide equally like this, sometimes we might not generate what we call over-harvesting scar in the patient back of the head. Now it's become what I call non-shaped FUE. This is the result right after the surgery. You can see the patient's back of the head is feel like intact. The hair, the existing hair, copper. In this patient, I did it like 3,000 grafts. So you barely see the scar in there. And then you can see like, okay, if this area have denser than the other area, you can continue harvest on those areas. So in this case, you have preview the result on the donor area as well. Okay. So I try to introduce to you the long hair techniques. This is my patient. All of my patients in the picture, I got the side consent to present already. So this is Norwood grade 3 because they have only like M-shaped receding hairline. So he afraid that he might have some bandage and scar, and he can't face other people because he meet other clients a lot during a day. So he asked me to do the long hair techniques for him. This picture in the middle is right after the surgery. I give him the coverage that he need. It's about 2,500 grafts. The picture at the corner is before he start to consult with us. So those M-shapes see really clearly. And then the lower picture is 1 week after the surgery. Actually, after finished the surgery, I did not apply any bandage. I did not apply anything on their head. The next day, patient can go get the coffee easily without notice anything. Might be swelling a little bit, but not that much like before. So let's compare the traditional methods with the long hair techniques across key aspects, as you see on the table. Let's see if you see clearly. Okay. So the first one, the immediate post-op appearance. Of course, for the traditional techniques, you have to shape the area. For the long hair, you have the existing hair conceal those procedures. Recovery and social downtime, of course, for the traditional one, you get the larger because of the visible change. Some people have to wait until 10 days to see others to get all of those scalp, all of those fibrin out of the head, and they feel confident again. Some people have to hide themselves almost a month. But for the long hair techniques, it's reduced. Actually, within 3 days. Basically, for my practice, it's only next day. Patient can go out and meet their friends easily. The only one that hindered them to meet their friends or The significant one is only the swelling due to the tumescence that we apply during the procedures. And then the technical challenge, of course, is straightforward for the traditional techniques. You just use one motion, is rotation motion, use just only sharp punch, which is really cheap. But for long hair technique, of course, you need more precision. You need the punch that designed specific for hair to get in there without rotating with the machine. And also, you cannot punch just like what you usually punch. You used to use what we call oscillation punch in that. Also, when you implant also, when you get the short hair, you cannot even see that what is the direction look like. You just implant those small things in the patient's scalp. But for the long hair, when you get the graft, normally I cut into like 1.5 inches in length, so you can see like the direction of the hair, so we can put and implant it more naturally look. Patient selection, of course, if a patient don't care about shaving, just go ahead and get the traditional techniques because it's cheaper and I wouldn't say it's better, but I just say it's cheaper then. Idea for the long hair, of course, if they want to look good after that, at least see the preview, the result after that, you just go ahead and get long hair. Otherwise, you have to wait until like, I would say 4 months, 5 months or 6 months until the hair grow long enough to see the direction of the hair. By that time, some patients think that, okay, it might be a bad idea to get that one because some patients get the hair direction is out of order and stuff. Cost and time lower, of course, for the traditional one, and higher cost and longer procedures for the long hair techniques. But I would say that actually practice make closely to perfect. Right now, we can do long hair techniques using the time about the traditional one. Okay. The analogy of the hair transplant evolution is like this. Think about the evolution as akin to the photography. So the traditional techniques are like the film cameras. So you capture the image, but wait to see the result. First 3 months is shedding period, all hair fell down. And then another 3 months to get longer. So basically you see the result pretty much about 6 months. So that's what you tell the patient. However, for the long hair techniques, it's like a smartphone photography. It's instant result and real-time adjustment. If you look, if not, they don't have the cover enough, you just add more grafts into that area. Instead of like just calculate how many density, like for achieve the cosmetic look, you probably need 25 or more grafts per centimeter square. But it's just what you thought. When into the real life techniques, you probably need more than that. And some of them, when they have the limitation on the donor supply, you probably have to adjust accordingly. Maybe you use less than that to achieve the result that you're looking for. So, okay. Now, let's discuss about a case study. So, this is my patient. I would say mission impossible if we use the short hair techniques. So Mr. Wong, a 60 years old gentleman from Hong Kong. For 16 years, he wore a wig, dreaming of having a full head of hair again. Despite being turned away by many clinics due to his Norwood grade 7 hair loss, Mr. Wong found hope with the long hair techniques. So this patient, I accepted, actually I reject him. I say, you probably do not need hair transplant. Hair transplant probably not the right answer for him because he have very large area to transfer, to transplant. So he went to get the second opinions from several clinics and it's come back at the same time. They say like, okay, he want to have a hair back. He say like, okay, 16 years already have one a wig, so just at least get some hair for me. He said, just get some hair for me. So I consult him with, okay, maybe if we use long hair techniques, it probably help, but he have to go at least to transplant.
Patient
Yes,
60 years old, male,
this is
with the Norwood grade 7. The plan is have to restore the frontal hairline with the temple area to connect it, make it natural look. However, we recommend the patient to take the dutasteride for a year to help hair grow on the thinning hair on the vertex. Since the donor area is really limited, we try to take as much as possible. With what we use today techniques is the non-shaven techniques to forgive the prevail the hairline for the patient and for the surgeon to see if the coverage is enough to get the cosmetic look. Since the area of the transplant is really large, we probably plan to do like 25 grafts per square meter first, centimeter square first, and then let's see what we have on the donor area.
in the hair transplant field. Actually, assessment and planning is the key. Okay. When you talk with the patient will decide right after you give them the consultation if they trust you to do the hair transplant or no. Because unlike other procedures, hair transplant is limited. After you pull the hair from the donor area, is no more for them. It's just one shot transplant. So we have to use those results carefully. So we evaluate the donor and recipient area first when we meet him, and we focus on, for this patient, we focus on the frontal hairline and temple to get the initial impacts. One thing that we have to work on is we have to gain the patient confidence. Of course, we want them to look good, but we need to make them trust in our procedure first. To make them trust that hair transplant might be the answer for them. So the hair is really grow. That's what we need to prove for the patients. And then we customize a treatment plan to meet the realistic expectation. Like I said before, maybe I cannot make that dense for this patient because in the area of number 1, number 2, number 3, and then almost number 4, I can do only that area. If I have the unlimited supply, of course, I want to do all the area. But in this case, I can plan just do the frontal area and the temple. And then even in the clips, I say that we plan to give them the dutasteride for a year to see, not only to help transplant hair to get stronger, but also help the existing hair to get stronger also. Now look at the real patients here. This is what I planned for him. So when I planned at first, the temple area is like very large. I have to connect the hair to the temple area with the back of his head, and then connect with the front of the frontal hairline also. Here's my technique. You don't need to make the density equal for the whole head, but I tell the patients I will make it thin for the whole head. Okay. So I make the back of the head thinner, but I use those hair to put more dense in the hairline. So make it totally thin, look blended. Okay. And the problem that I see on this patient is he not only have the larger area to be transplanted, but he have lots of gray hair. Okay. So if you transplant the gray hair into that area, the visible look is not changed that much because it's no color. So in this case, we have to plan that I will take all of the black hair from the back of his head without taking any of single the white hair. And then if I do have some over harvesting in some area, I just, in the next surgery, I just place those hair in that area again. So if he trusts in these procedures, if this procedure really work well, of course he will come for second surgery. And in that case, I will tell him to dry his hair before seeing me. Okay. Then, after we do it, this is the result. So actually, you can see the look of his face. He actually smiled the whole time when he see himself in the mirror. The face is changed right away. Now you can see all of those, the scar in the back, and they connect to the hairline. To look at the front, the temple area. So I still leave the vertex area intact because I hope that dutasteride that we recommend him to take might work, and we'll see for the next surgery. So I actually transplant almost 3,000 grafts for using the long hair techniques in extract and transplant hair while maintain the length of the hair. And then I use real-time strategic placement to maximize the immediate visual impact. So I keep asking the patient, if we have short of the supply, can we do just this and that? And we do the real-time styling for the patient feedback during the procedures. So after we do that, Mr. Wong, he was thrilled and immediately improvement, even before the full result became visible. So I got hair again. Actually, he has the tear come out also. So then we come to the medication and follow-ups. To support the transplant, we prescribe dutasteride, 0.5 milligram every day first, because dutasteride need about 3 months to reach the therapeutic levels, and then we can reduce the dosage accordingly back then. So we aim to strengthen and thickening the hair in his vertex area also. So, and then we also do the follow-up care. So we regular monitor and the graft health and growth. We ask him to come to the clinics to do the PRP for every month and continue the scalp care guidance to get the optimal results. Because we know that even we use the long hair, it doesn't mean it's no shredding phase. It still have the shredding phase, but at least the patient have hope that, okay, when their hair grow, it's gonna look like this. So the results, the transformation was remarkable. Mr. Wong has overjoyed with his new hairline and temple density. He even shared that he now feels confident enough to go out and buy coffee without his wig. So this is just like a reward to you guys. You know, after your patient say like this, all of those back pain and neck pain during the procedures pretty much go away. So conclusion and future plan, Mr. Wong satisfied with his procedures is a testament to the effectiveness of long hair techniques. We plan to follow-up procedures for the further enhancement in a year, focusing on the other area of his scalp. So thank you for your attention today. Okay, this is just the introduction for the long hair. I not really go into the detail like what machine that we use, what kind of punch that we use, but I hope that you enjoy this introduction of the long hair and might apply in your clinics also. So the long hair techniques signify the groundbreaking step forward in hair restoration, offer patient immediate results and unmatched discretion. As seen in Mr. Wong's case, even the patient previously deemed unsuitable for transplantation now can achieve life-changing outcome. Now I welcome all the questions from you guys. ขอบคุณครับ
Thank you, Dr. Bond, for valuable insight. Does anyone has any question for Dr. Bond?
ครับผม
ขออนุญาตถามเป็นภาษาไทย
ได้ครับผม
พี่บอลเทคนิคลองแฮร์แบบ พี่บอลบอกว่าทำได้เร็วเท่าแบบเทคนิคปกติเลยมีอาจารย์มีเทคนิคยังไงแล้วก็แบบว่าใช้เครื่องมือพิเศษยังไงหรือว่าแบบทำยังไงให้มันแบบว่าได้รีซอลใกล้เคียงปลูกได้เยอะแล้วก็ปลูกได้เร็วเท่าแบบเทคนิคธรรมดา
ใช่ครับมันอยู่ที่ว่าถ้าเป็นเทคนิคธรรมดาเนี่ยเราใช้โรเ t ชันมาตลอดนะครับส่วนใหญ่โรเ t ชันเนี่ยมันจะใช้เป็น muscle memory ส่วนมากเราจะใช้เทคนิชเชียนเป็นหลักเพราะว่าถ้าเราทำเองเนี่ยเราทำไม่ไหวด้วยเราต้องแบ่งงานกันทำนะครับอย่างที่เคยเห็นกันมาแต่คราวนี้พอเป็นลองแฮร์ปุ๊บเนี่ยมันเหมือนเป็นบังคับว่าเราต้องทำเพราะว่าเทคนิชเชียนเราทำไม่เป็นถูกไหมครับมันก็เลยทำให้เราต้อง develop เทคนิคใหม่ๆมาช่วยเสมอนะครับเทคนิคที่พี่ใช้ก็คือผมจะใช้หัวพันที่เป็นบลันเป็นหลักนะครับผมอยู่กับการเซตติ้งของเครื่องเพราะว่าเราไม่สามารถ effort ในการเสียกราฟไปได้มากกว่านี้ละนะครับถ้าเราสังเกตช็อตแฮร์เนี่ยเรา have transaction rate ค่อนข้างที่จะสูงมากนะครับกราฟมันตัดเพราะว่า direction มันไม่ตรงการที่เรามาใช้พวก blunt มา utilize พวก blunt punch มากขึ้นนะครับกราฟมันแทบจะได้ทุกกราฟเลย transaction rate เนี่ยน้อยกว่า 0.5% อีกนะครับใน100กราฟเนี่ยน่าจะมีสักกราฟเดียวนะครับที่เป็น transaction rate นะครับคราวนี้วิธีที่เราไปเนี่ยเราต้องเข้าใจเรื่องเทคนิคของ oscillation มันเป็นเทคนิคชั้นสูงหน่อยนะครับ oscillation ก็จะมีการเป็น arc การที่ลองแฮร์ไม่พันกับผมเนี่ยถ้าเราใช้ rotation สิ่งที่เกิดขึ้นก็คือแน่นอนเส้นผมยาวๆของคนไข้เนี่ยมัดกลายเป็นว่าเราดึงผมคนไข้ทรมานคนไข้อีกสิ่งที่เราใช้นี่คือเราใช้ back and forth นะครับคราวนี้ต้องอยู่ที่มือของคุณหมอแหละว่าถนัดกับ arc แบบไหนแล้วถนัดกับหนังศีรษะแบบไหนมากกว่านะครับคราวนี้พอมันได้ทุกกราฟปุ๊บเนี่ยมันก็เลยทำให้เร็วได้เท่ากันนะครับส่วนตัวของผมเองเนี่ยผมไม่ทำช็อตแฮร์ละเพราะว่ามันทำเร็วเท่ากันละเพราะฉะนั้นเนี่ยถ้าเราให้เลือกเอาง่ายๆสัมภาษณ์คนไข้10 คนผู้ชายนะครับว่าอยากทำแบบสกินเฮดแบบกึ่งสกินเฮดที่ไล่ผมเลยกับโกน10 เต็ม 10เลือกสกินเฮดนะครับถ้าราคาเท่ากันนะ ถ้าราคาเท่ากันนะครับเพราะฉะนั้นเนี่ยการที่เราทำได้เท่ากันเนี่ยเรา offer option ของทาง practice ของเราให้มากกว่า practice ของคนอื่นมากกว่านะครับตัวพี่ก็คือผมจะตัดผมให้สั้นประมาณ1 เซนใช้เฟดเบอร์3นะครับถ้าคนไข้ไม่ได้หมายเรื่องผมต้องยาวเลยนะครับแต่ถ้าคนไข้ต้องการผมยาวมากๆแน่นอนต้องมีเวลาที่มากขึ้นเพราะเวลาในการเกลี่ยนะครับจริงๆแล้วการพันช์เนี่ยไม่ใช่เป็นสิ่งที่ทำให้ procedure ช้าลงแต่เป็นการเก็บกราฟมากกว่าถ้าเรามีการเก็บกราฟเพราะว่าถ้าคุณหมอพันช์อย่างเดียวเนี่ยแล้วคนเก็บกราฟเร็วเนี่ยเผลอๆเร็วกว่าช็อตแฮร์อีกนะครับแต่ว่าคุณหมออาจจะต้องใช้คุณเพิ่มขึ้นมาอีก1 คนในการเก็บกราฟลองแฮร์ตามมือของเรานะครับแต่สิ่งที่คุณหมอจะได้มากกว่านั้นก็คือคุณหมอจะสามารถ harvest ใน area ที่ช็อตแฮร์ทำไม่ถึงนะครับอย่างเช่นดูรูปของการ harvest สิ่งที่เกิดขึ้นคือในรูปตรงกลางนะครับบริเวณ nape area นะครับเอาไม่ได้เลยนะครับเพราะว่าไปเจาะยากมากเป็นบริเวณที่มีcutaneous fat ค่อนข้างที่จะสูงแต่ถ้าคุณหมอใช้ช็อตแฮร์พันออสซิเลตเข้าไปนะครับโดยใช้บลันกราฟคนอย่างคนไข้อันนี้ครับคนไข้ของผมเนี่ยผม harvest มาถึง nape area เลยเพราะนั้นจริงๆแล้วเรามี area ในการ harvest ได้เยอะกว่าแล้วผมบริเวณ nape area เนี่ยก็เป็นผมที่อ่อนมาทำเป็นไรผมได้มากกว่าด้วยซ้ำนะครับและเราสามารถเลือกกราฟที่แข็งแรงได้ชัดกว่าเหมือนกรณีเคสของคุณวองเนี่ยที่เราเลือกแค่ black hair อย่างเดียวได้ถ้าเป็นช็อตแฮร์เกิดอะไรขึ้นครับเชฟไปหมดทำอะไรไม่ได้เลยนะครับบางทีก็ต้องเอามาทั้งหมดเลือกก็เลือกไม่ได้เพราะอะไรเพราะเราไม่รู้ว่าถ้าเราเอาตรงแอเรียนี้มากไปจะ over harvest หรือเปล่าจะทำให้เกิด dot scar อะไรหรือเปล่านะครับยังไงก็ตามก็ยังเชื่อว่า long hair จะเป็นฟิวเจอร์ของ hair transplant นะครับในต่อไปนะครับ
ขออีกคำถามหนึ่งสั้นๆครับ
ครับ
มันฟังดูดีมากเลยทีนี้เนี่ยเราข้อเสียของลองแฮร์เนี่ยมีอะไรที่มากกว่าช็อตแฮร์ยกตัวอย่างเช่นมันจะเพิ่ม infection rate ไหมเพราะว่ามันทิ้งเส้นผมที่ยาว หรือว่าอย่างที่สองแบบสมมุติว่ามันมีเส้นผมอยู่มันจะ require nutrient มากขึ้นที่ทำให้แบบมีโอกาสกราฟร่วงเยอะขึ้นไหมหรือว่า popping เยอะขึ้นไหมครับ
จะมีตอนที่ระหว่าง implant มากกว่าครับที่มันจะอาจจะไปเกี่ยว implanter ได้ แต่ส่วนเรื่องการ popping จริงๆแล้วเนี่ยสิ่งที่ amazing มากก็คือเวลาทำ long hair เนี่ยปกติแล้วผมสระผมทันทีเลยหลังทำแล้วก็ไม่ได้ร่วงอะไรเลยนะครับเพราะว่าอย่างที่บอกเราต้องการที่จะล้างไฟบินอะไรออกให้หมด เพื่อให้เขาได้ cosmetic look นะครับคราวนี้เนี่ยเคสที่ทำไปผ่านมาเนี่ยยังไม่มีเคสไหนที่โชว์ infection เลยนะครับไม่มีแม้กระทั่ง folliculitis ที่เราเจอในช็อตแฮร์บ่อยๆ ปรากฏว่าช็อตแฮร์เนี่ยเราเจอ folliculitis มากกว่า long hair เสียอีก เพราะว่าอาจจะเป็นเพราะว่าผม prophylaxis ด้วยการให้ ceftriaxone ไปด้วยนะครับผมประมาณนี้
ขอบคุณมากครับ
ส่วนก็ยังยืนยันครับ long hair ดีกว่าแทบจะทุกจุดนะครับแค่เสียเวลาแค่นั้นครับผม
ขอบคุณครับ
โอเคครับขอบคุณครับ